The broadcast is now starting. All attendees are in listen-only mode.
Good morning and good afternoon. Welcome to the webinar titled Detecting and Preventing Healthcare Breaches, Best Practices. My name is Anupam Sahai. I'm co-founder and CEO of HIPAA Incorporated. I've been in the high-tech industry for 25 plus years and have been working in the areas of healthcare IT, cloud computing, security, compliance, and networking. I'm very happy to have Jared Barrett with us today. He's the Chief Operating Officer and VP of Business Development at Maze Analytics, and he'll join me in the session today. So from an agenda perspective, we will start out by talking about why the need for having and dealing with data breaches and the current state of privacy and security detection. We will review that and what are the areas of risk exposure with the state-of-the-art technology and market landscape will be reviewed as well. Then we will talk about how privacy and security detection is growing in effectiveness and the best practices and the key lessons learned from the trenches that will be discussed after that. And at the end, we will talk about automation tools to manage privacy and security, and HIPAA and Maze will be described in some detail to help you unravel and solve the current state of data breaches and that are out there. At the end, we will have Q&A. So as we are going through the webinar slides, please type in your questions in the GoToWebinar questions area, and we will pick it up at the end. If you want a copy of the slides, please do let me or Jared know about it. We will have our contact information at the end, and we will also mail out a copy of the webinar recording to you in case you would like that. So with that, let me get started. So the key problem that we are addressing is the cybersecurity breach problem, and that's a huge rampant problem. Pretty much every day there's a breach report that shows up in the press and media, and healthcare is the primary target of all these breaches for the simple reason that the value of the healthcare record is the most it's the most valuable record. It's roughly about anywhere between 3 to 10x valued compared to any other information. So 66% of all breaches targeted healthcare in 2015. 115 million records were breached, and these are terrible statistics from a healthcare organization perspective. The other challenges that the healthcare organizations face is the regulatory stick that the government has now. Because of HIPAA Omnibus that was enacted in 2013, every healthcare organization is required to be HIPAA compliant. They need to take proactive steps to manage the business associates and vendors. Otherwise, they risk huge fines or patient lawsuits and brand damage in case they get breached. So you can see some sample fines and breaches that resulted in patient lawsuits, etc. These are sizable numbers for any healthcare organization. So to summarize the challenges that the healthcare organizations faced, because of all the government mandates and the data breaches that are happening, every healthcare organization needs to take steps to be HIPAA compliant. They need to make sure that they're staying on top of the security gaps that are found through security risk analysis, and they need to do that in a continuous fashion so that they continue to be secure and compliant and manage the risk proactively. And some of the challenges are that these solutions are not not there. So with that, let me bring in Jared and have him talk about the state of the privacy detection. Jared?
Thank you, Anupam. I appreciate that. And everyone on the webinar today, I appreciate your attendance as well. So very briefly, I will kind of go through the current state of privacy detection. What's out there, what are the challenges? And with that in mind, we all know breaches are expensive if they get caught, and there was some negligence on the covered entity side. But more important than that is that they're very hard to find. We find many organizations are doing very sparse privacy detection policies and processes, and that the ones that are trying to be most proactive are still finding that the current systems available or have been available for the past decade are really not standing up to the velocity, the viscosity, and the variety of data that's coming at them every day. And so it's making their jobs very challenging. Through both customer and prospective customer interfacing, we found that privacy technology users in this space that have some type of technology to assist them with privacy detection to help mitigate risk is only in the realm of about 40%. And the other 60% of the hospitals and health systems out there from the provider side are still doing this in a manual process. And by manual process, I mean specifically they are getting PDF or Excel reports of their audit logs, whether they're using Epic, Cerner, Meditech, McKesson, or a combination of all of them, and then trying to correlate that data in order to semantically understand their privacy risk analysis. But as you know, and if you ask any privacy compliance or information security person, they'll tell you that that is one, ineffective, and two, very time consuming. So it's causing a bottleneck in the lifespan of proactive privacy detection. And when we think about how much data is out there and how much is coming at the privacy and information security teams on a daily basis, not even an annual basis, we found that the average PHI coverage of these organizations is only around 5%, and that's actually being more gratuitous with that than most organizations find. Those that are using either manual or some type of very basic rules-based approach are typically seeing anywhere from a little less than 1% to only 3% coverage. So that's a lot of risk. There's anywhere between 95 to 99% non-covered PHI when it comes to privacy detection. And that's a real challenge for our space, and which is why Maze has kind of come in here to address this for not only the covered entities looking to understand their employees, but also for the business associates that might have access to their PHI as well. So that's really the current state of privacy detection. And Anupam, I'll hand it back to you.
Thank you. Thank you, Jared. And from a risk, security, and compliance perspective, the current state is very similar. There are different applications that do bits and pieces of risk, security, and compliance. It's a very manual process. It's very complex. It's expensive to own and manage. And the burden of interpretation of the data is left to the end user. So all of these applications are spewing out information that needs to be analyzed and assessed. And that's the real challenge that organizations face today. So automation is a key problem. Now there are other challenges that is more related to policies and procedures and roles and responsibilities that I think is getting better with the day, and getting every employee trained about how to handle PHI, what information to share internally or externally. All of those issues are something that organizations tend to work on and need more effort. The other big challenge is that not only are the tools siloed or fragmented from a risk, security, and compliance perspective, but we found that many a time there are different people or organizational groups that are doing privacy, security, and compliance. And some of it is handled by IT, some of it by the security team or the compliance team. And there's a lot of communication gap or different tools that don't talk to each other problem. that result in some of the risk exposure that organizations have. So Jared, you want to talk about some of the changes that are happening?
Sure, and actually, Anupam, just to kind of jump back and echo on what you said from the previous slide, if you want to go back one. Yeah, I would say that a lot of these key points and areas of exposure are very similar in the privacy space when it comes to compliance, with protecting PHI. There haven't been many automated tools that are taking into account, the need for a single unified view of privacy, both the audit log, the clinical notes and applications, as well as the operational data that they're getting. And roles and responsibilities are very convoluted and somewhat muddled sometimes. And that is a very big challenge because it's who's responsible for this piece, and maybe that person is wearing several hats at once. And that can make a struggle with education and the feedback loop of education from discovery and detection to what is the consumer, the customer doing or our customers doing in order to take that data and that knowledge learned and put it back into the organization with better, more focused training and education. And a lot of them are looking to leverage this siloed approach of privacy, security, and compliance to unify them, to not have them say, I do this and you do that. We are all in it together. And so next slide, Anupam. So, the space is growing. A lot of what people are trying to do is aggregate data agnostically across their systems. It's not the day where you just had Epic or just had McKesson. You might have mainly an Epic, EMR environment that includes a lot of the ancillary modules, but maybe you still have GE packs or you have Lawson databases, and you need to get all of that information in so you can have one unified view. And so as this space grows, we're seeing more organizations, especially like Maze, that are looking to take clinical, operational, HR, and financial data and do agnostic data stitching so that we can provide that unified view. And additionally, it's been the growth of machine learning. It's probably one of the biggest buzzwords that we're using or have heard from our customers as far as a need in the healthcare privacy space. They want tools and applications that use or leverage machine learning to actually learn behaviors and not assume them from the get-go. They want to be able to understand this behavioral analysis between the audit logs and the encounter information and the patients that are coming in, and how those ICD-9 and 10 codes are connecting with the employees who treat those ICD-9 codes, and how can we match that ICD-9 or 10 codes to those HR employees or the employees with certain HR codes. And the one thing you can't do without now is automation. If it's not automated, nobody seems to want it anymore. It has to be able to do a proactive daily audit. It needs to be able to be documented so that people can, and the users of these tools can go back and have, provable, certified evidence of what they've done and what actions were taken. And again, like I said, they want at a minimum daily audits. They want to take that privacy audit coverage, which they're typically getting the 1 to 5%, and flip that on its head and say, you know what? I want everyday analytics to be used. And when they're doing that with tools like Maze and leveraging machine learning with data stitching to eliminate those silos, we're starting to see our customers that can get 95% of all the data that they generate in a day, a week, a month, a year, automatically audited and filtered away as it was appropriate for reasons. It was appropriate for encounters, and leaving only small subsets for themselves. This is, ideally what they want to make themselves more efficient. And you can take back from there.
Yeah, thank you, Jared. So from a key lessons learned for organizations to leverage, I think, as we said earlier, HIPAA compliance is not an option. It's a mandate and it's a requirement, and that in turn starts off a number of very important things for an organization that is very important for everybody to be HIPAA compliant. And part and parcel of HIPAA compliance is that there are specific roles and responsibilities that that make people accountable for what they're doing, and having the right policies and procedures in place, putting together training so that every employee is aware of what their role is, what are the do's and don'ts from a policy perspective, from how they need to handle PHI information, who gets to share it, and how will it be shared, how will the data be sent across organizations internally or externally. All of that is part of the training that that everybody needs to be aware of. And then having automated tools for privacy auditing and monitoring, security scanning, and doing it regularly is very important. And while these tools will tell you what the problems are, you need to stay up to date, make sure all the applications and operating systems and all the misconfigurations that are identified by these automated tools are followed, the advice is followed, so that you're able to stay on top of patching and making sure everything is up to date. And then from an organizational perspective, a lot of these cyber attacks are actually taking advantage of the fact that many people are not security trained. They're not aware of what can cause these breaches from taking place. And typically, one of the biggest entry points is by sending an email with an attachment that you click on, and it kind of takes over your machine, and then from there it kind of takes over the entire network, and thereby your data is breached or held at ransom using some ransomware technologies that are out there. So the bottom line requirement is that you need to be not following any unsolicited links in emails, not opening any attachments, and not going to parts of the web, internet, where you're asked to download some player or some update that can cause some of these data breaches from happening. And having the training, the policies and procedures in place, the training and automated tools that can detect any such violations is very important. So Jared, do you want to add anything to that?
There's not too much more to add, Anupam. I think you did a great coverage on that. I would just say also that, point number one, become HIPAA compliant. I think one of the biggest things we always tell our customers is that HIPAA compliance is a moving target, so you can't take your eye off of it. You can't check a box, buy a system, implement a tool, and then assume it's done, it's over with for the next 3 years of that contract term. So always remember that HIPAA compliance is going to be a moving target for you, that you have to make sure that, at least from a privacy perspective on the edge of the fence where I sit most of the time, that you assign someone those roles and responsibilities to understand and continually understand a deeper learning of who are the roles in your organization and what are they responsible for, and understanding the policies and procedure as they equate to privacy adherence for these organizations. And one of the biggest ways to know that and do that is training. Making sure that feedback loop is always consistently moving and lubricated so that it's seamless and effective for each organization. And I would definitely echo what you said about not following unsolicited web links. We have strict policies in our organization that if you don't know that person, if we haven't emailed or had some type of communication, don't send them a link and don't expect links from them, and don't open them unless they specifically mentioned it in a previous email. I couldn't tell you how many times we've detected a phishing attack because one of the organizations, a nurse or a practitioner, opened an email, clicked a link. Now someone has access to either their email, and a lot of the times we find email logins are very similar to their clinical and operational data logins, and so very often we find phishing attacks through there. So training that will help lower that, but it's also great to leverage the privacy knowledge and making sure privacy officers understand that email phishing will eventually come back to them from a privacy perspective. So just knowing some simple effective best practices as far as how to interact with links and on the web as well.
Yep. So I want to reemphasize what Jared said, that privacy, security, and compliance is a journey. It's an ongoing process. And so it's very important to do continuous monitoring to make sure that you're staying on top of any changes that might be happening inside the company or in the environment. There might be new employees coming in or employees that are leaving. There are new threats and vulnerabilities that are being discovered by the day. So it's important to stay on top of any changes and use automation to make sure that you're able to track and monitor that. So having said the problem and the state of the industry and what the lessons learned are, the key question is, how do I implement, which seems like a whole lot of things that we need to do as an organization. And this is where AG5 and Maze have partnered together to get you a single solution, unified solution for dealing with all of your risk, security, privacy, and compliance needs. So what we provide is a single application that does assessments, scanning, remediation, training, and continuous monitoring. And no more siloed or fragmented tools. You get a single dashboard with a combined view of your entire organization's risk, security, and compliance posture. And you're able to scan assets, schedule scans, schedule assessments, do risk analysis, and you're able to stay on top of any changes that are happening by the day. And there are multiple services that work together to bring you this unified view that you see here. So Jared, you want to describe how the privacy automation takes place, monitoring automation takes place?
Yeah, that's great, actually. So, the first step along this path, and that's the baseline. We really need to diagnose what's going on with the privacy stance of each covered entity. And we use this by first kind of coming at the organization with a privacy by design scoring. How effectively is the privacy team intertwined with information security and IT, and when there is new technology processes and projects, how are they interfacing with that from the core outwards? Are they making sure that privacy is going to be in the room and at the table with each type of operation that's coming into place? And then additionally, we start to benchmark these organizations as well, because it's really important for them to have a deliverable return on investment when they're looking at these tools to use to enhance privacy detection. And so we benchmark what they do today, how effective it's been, and then work with their information and IT teams to do data gap analysis. What data are you collecting currently? Could you be getting better data? Is it clean? Is it not clean? And for our organization, we take data agnostically, clean or unclean, but we want each covered entity to know what's going on so that they can do better best practices in the future. And so moving on, we get to the remediation section. Let's detect privacy breaches or potential incidences and then respond to them. The technology deployment is a big part of our working with organizations. Because we don't just plug and play. We can plug and play, but we like to plug, play, and continually make the game better for them. So we plan and holistically plan out timelines, executions, and revisit those timelines when they think that there might be some new data source coming in, or there's a big growth in the organization. They're buying 7 new hospitals, and so how is that going to play into their data privacy detection process? And so it's a holistic privacy strategy. And that also includes, user training and establishing their own best practices to assign roles and responsibilities. And then the remediation, responding. Once we help a customer find those incidences of snooping or credential phishing that's leaked into, accessing the EMR, how are we going to react to those, and what is the proper method of investigation management for that customer? And that's a very consultative approach, which after we do it, they have a very rinse and repeat methodology. Like to do train the trainer. And then change management. I think often it's a lost art in the continuous monitoring piece of this puzzle. But in order to do future protection of the organization, it's important to understand that once you detect something and you have to respond to it, whether good or bad or not, you need to take that information you've learned and communicate it back to the organization and the individual users with a more scalpel and hammer approach. Let them know about the policies, let them know that you're using technology that is going to help them detect privacy violations very granularly, and let them know how that might impact employees or might not impact employees, but still kind of affecting that subconscious change in the way that employees are accessing records, both appropriate and inappropriately. And then plugging the outcomes from that change management back into the baseline really helps us formalize the outcomes gap analysis to go from today to tomorrow and yesterday to today, so that the work that the privacy and security group have done thus far is realized and recognized by those that are in the board level and C-suite. And then I would say again, with the solution that we provide, that we partner with Agify on, we as well do a unified dashboard. We don't want people to have to jump through systems or move around too often in order to get the information they need. They want the information to come to them. And so, we're providing privacy and security reports and statistics that are going to make it a lot easier to find the information you're looking for, but it's also contextually driven data. It's not just privacy incident happened here at this time. It's this incident happened at this time at this workstation between this employee and this patient, and that employee did an order for radiology, so that you can get deep contextual learning for each type of incident before you have to try and take this to the next level or experience false positives or false negatives. I would say that kind of concludes what we do here, really closing the gap.
And from a risk security and compliance perspective, the workflow automation is similar, where the first thing is that you're trying to diagnose all kinds of gaps that might exist today through a combination of a scan. You can do an assessment and risk analysis, and once you diagnose all the gaps, the next stage is to cure or remediate all the open issues that are found. And this will involve typically a combination of training. There might be new policies and new contracts. There might be best practices that need to be established. And again, we will guide you through the process of remediation as well. And once you've fixed all the problems, then you get into a continuous monitoring mode or a protect mode, where you're able to stay on top of any changes. And while you're doing this, you have access to a unified dashboard that gives you an organizational-wide view of your overall risk, security, and compliance posture, and you can generate multiple reports and are able to stay on top of any changes. So to summarize, what we are doing is really removing the silos, the fragmented application approach, by giving you one single application that gives you a single dashboard and single pane view of your entire organization's risk, security, and compliance posture, and thereby it's cost effective and simplified from a deployment and management perspective. So with that, let's close the particular the webinar today by saying, and hopefully you agree, that the privacy and security is a huge burning problem today. And while there are lack of good automation and monitoring tools that are in the market, that exist in the marketplace today, through a combination of Agify and Maze Analytics, we are able to give you a complete automated solution for privacy, security, risk, and compliance management capabilities. Jared, do you want to add anything in closing before we take the Q&A?
Yeah, I would just echo much of what you said, Anupam. Privacy and security is a big problem. It's something that just needs to get a really deep understanding, and more than just saying it's a problem, organizations need to ask themselves the very hard questions. And sometimes organizations do it well, sometimes they don't. And that could be just as simple as saying, we're not good at this. How do we get better? Who do we need to interface to make ourselves better? And is this going to be something that we need to put sweat, blood and tears into in order to get from A to zinc? And while in the past there's been a lack of good monitoring tools that are that had automation, I mean, the shameless plug for Maze is that was our entire goal. We aim and we do use patented machine learning and automation at the core of every type of analysis that we do. And so that is kind of the new baseline for the detection of privacy violations here as we go forward through 2016 into the near at least the next 3 years. And that organizations that have turned a blind eye to privacy because either a lack of funds, responsibility, or just hadn't seen a tool that they thought was ultimately useful are going to have to revisit themselves and say, look, we can't hire 100 privacy analysts to get us to where we need to be with our detection models. We have to really look out there in the ecosystem to find those vendors like HIPAA and like Maze to leverage that to make the most of the resources we have today. And again, as Anupam mentioned, HIPAA working on the network and the asset side together with Maze provides this really great holistic view whereby we can get security information in a timely manner that allows us to automate a privacy analysis into a user if there's question or if there's risk involved with how or any type of access or any type of potential intrusion into a healthcare system. So no, Anupam, I think you hit the nail on the head, and I'm very happy to add to that.
All right, thank you, Jared. So let's open it up for Q&A. If you have any questions, please type it in the questions area of GoToWebinar. That will be on your GoToWebinar panel, and we will take it up one by one. So Jared, a question. So how does your solution compare to the competition that's out there? Jared, maybe you want to start with Maze, and then I can talk about HIPAA.
Sure. So from a Maze perspective, there's only 2 types of competitors that we find out there in the market. There's rules-based analysis. Those are using simple static flags. Do we have the same last name? Do we live on the same street? And then there's more outlier detection models. Both have their benefits and drawbacks. I would say that individually those 2 types of competitors are kind of coming at this triangle of privacy approach at one corner, and neither do clinical context and machine learning. And so how we compare is that we do use traditional flagging methodologies. We mix that with our machine learning and clinical context to derive not just the what and when question, but the why, which is ultimately what every privacy officer wants to know. Why did this person access that record? Or why was this employee in all of these different records on a different time? And so by, when we compare that, for our competitors at least, we find that they're severely lacking in the ability to answer the why question. And that's why privacy officers are struggling to have a strong program in place.
Okay, and on the excuse me, on the risk security compliance side, as I mentioned earlier, that there are a number of solution providers that are focusing on one area only. So there are risk management tools, there are different category of security monitoring tools, and compliance management as well. What we have done is to provide this comprehensive, unified view where you get a single dashboard view of the entire organization's risk, security, and compliance status or posture. That's very unique in the industry, and at the back end, that's driven by expert systems technology that allows us to integrate and unify the different siloed views otherwise. So it's in that sense very unique in the industry. So I know we're kind of running over time. Maybe we'll take one more question before we close. How do you price the solution? Jared, you want to go first?
Sure, thank you, Anupam. For us, we found that most of our competitors and just other people in the market that were doing some type of privacy detection were doing it on a very convoluted model that mixes bed count with number of applications and number of users in the system. We wanted ours to be very unified, very scalable, and also something that was very palpable from a cost perspective. So when we price our solution to organizations, we have a core license value, which is $10,000 per year. That gets you all of the tool, machine learning, and all of the back-end 24/7 support. That's for any organization that's 2,000 employees or less. For organizations that are 2,000 employees or more, it's a flat additional pricing where we say it's $5 per employee per year that exists at that organization and has some type of login credential to either clinical or operational systems. So to put an example to that, if you are a 10,000 person hospital or a hospital that has 10,000 employees with access to your EMR, it would cost you $50,000 a year, that including support.
Yeah, and the pricing of Agify really is a function of the number of users that will be using the tool, the number of devices that will be secured, and and number of locations that will be deploying the solution. But it starts at a few $1,000s per year entry fee and can go up to $20,000 up to $50,000 per year subscription fees depending on the size of the organization. So one last question is, can HIPAA be adopted as a best practice in a different country and where HIPAA is not a legislative mandate? So I would say yes, because HIPAA is really a sort of best practices for developing and implementing an information security program where you're trying to protect PHI information, personal health information. So all of the best practices, the policies and procedures are really country independent. So yes, you can adopt HIPAA or a generic information security program like ISO or SANS 20 or FISMA that have a similar approach to protecting critical assets. So depending on the critical asset that you're trying to protect, if it's PHI, then HIPAA is relevant. If it's beyond PHI and any critical asset that needs to be protected, then something like ISO or FISMA, NIST are relevant too. So with that, let's any closing thoughts, Jared, from your side before we close the session today?
Nothing too particular. I think this was great. There's some great questions. I'm always here to ask anything more. We always urge people just to ask us questions. So if you're not sure about your privacy stance, or you want to know more, or you just want to bounce some questions off of us over here at either Agify or Maze Analytics to learn how you might be able to do things either better or just to reaffirm that you're doing things great, we'd love to hear from you. So that'd be a great way to kind of close it from my side.
Yep, we would love to hear back from you. If you, as Jared said, that if you have any questions on the webinar or on privacy, risk, security related topics, please feel free to reach out to us, and we'll be happy to take the questions. If you want a copy of the slides or the webinar recording will be sent to you. If you want a copy of the slides, then do reach out as well. We would love to hear back any feedback from you on the current session or any new sessions that you would like us to take up if that's of interest. So again, thank you for your time and appreciate you attending the session today, and have a great day. Bye for now.
Thank you.
Thank you.